You've likely watched that viral video titled Urgent, the Sjogren's symptoms you cannot ignore, this could save your life. Right? Well, they're right about some symptoms, but what they didn't tell you could change the way you look at your health. If you're interested in this topic, give us a like, subscribe, and type interested in the comments. Let's get the word out. And if any of these symptoms feel familiar, type noticed in the comment. In this video, you'll discover 10 critical Sjogren's symptoms doctors frequently overlook. Pay extra attention to symptom 4, because by the time you notice it, hidden damage may have already started, but catching it early can change everything. By the end, you'll clearly know the one symptom that demands immediate medical attention, the exact tests to request, and how recognizing these signs early can mean the difference between manageable health and irreversible harm. Symptom 1. Severe dryness. The hallmark of Sjogren's syndrome is extreme dryness, but it's not just the occasional dry mouth or itchy eyes you might experience on a rough day. It's the kind of dryness that takes over your entire body, making every single moment feel like a battle. Imagine waking up in the morning, your eyes gritty, your mouth like sandpaper, and nothing seems to help. Sjogren's syndrome doesn't just dry out your mouth or your eyes, it dries out your entire life. Let's start with the most obvious, but often overlooked symptom. Severe dry eyes. This isn't just a little irritation. This is when your eyes feel like sandpaper is scraping against them, every time you blink. The constant redness, the burning, the discomfort, it becomes a permanent part of your day. You find yourself reaching for eye drops every 30 minutes, but nothing seems to ease the sting. And it doesn't stop there. Your mouth feels just as parched, often so dry you can't even swallow without struggling. People with Sjogren's syndrome report waking up at night gasping for air, feeling like their throat is covered in sand. The lack of saliva affects everything: taste, speaking, even chewing your food. A simple meal turns into a chore. If you've been waking up with dry eyes, dry mouth, or feeling like your whole body's dehydrated from the inside out, don't brush it off. This isn't normal aging. It's a signal. And if it's happening more days than not, write it down. Track it. Because what you're experiencing could be one of the earliest signs of something much deeper. But the real issue isn't just about dryness, it's the damage it causes over time. For your eyes, the lack of moisture means an increased risk of keratitis and even permanent vision loss if left untreated. For your mouth, the dryness doesn't just lead to discomfort, it causes rapid dental decay, leaving you vulnerable to cavities, even if you brush and floss regularly. Most people with dryness like this are handed eye drops or told to drink more water, but that only masks the surface. Ask your doctor for a referral to a rheumatologist, and request specific tests like the Sjogren test for tear production, and blood tests for anti-SSA, Rho, and anti-SSB, La, antibodies. These are the real markers for Sjogren's. This constant battle with your own body makes daily life exhausting. You might try to keep going, but Sjogren's syndrome attacks in ways that are hard to fight off with simple remedies. That's why it's so important to spot these signs early, before the damage becomes irreversible. Here's the part most people don't know: there is relief. From prescription options like pilocarpine to natural approaches like omega-3s, humidifiers, sugar-free lozenges, and anti-inflammatory diets, there are ways to ease the dryness and protect your organs. But you can't treat what you don't catch. Symptom 2. Debilitating fatigue. This isn't just being tired. Sjogren's syndrome fatigue is something else entirely. It's waking up after 10 hours of sleep and still feeling like you were hit by a truck. It's not about rest, it's about your body being drained from the inside out. Patients describe it as walking through wet cement. Every step, every task, every thought, just heavy. You get out of bed, already exhausted. Making breakfast feels like climbing a hill. Brushing your teeth? A full-body workout. This is an immune-driven exhaustion that doesn't follow logic. You could be eating right, getting enough rest, doing everything correctly, but your body still crashes. The inflammation doesn't stop when you sleep. It keeps attacking, burning energy you can't replenish. And it's not just physical. There's the brain fog too. Words get lost. You forget why you walked into a room. Focus disappears. Holding a conversation feels like trying to read through static. This isn't forgetfulness. It's your brain short-circuiting under pressure. What makes this fatigue even worse? Most people don't believe you. Friends think you're exaggerating. Doctors brush it off. Even family may not see it. That isolation? That doubt? It cuts just as deep as the exhaustion itself. If this is your daily reality, here's something you can do: keep a fatigue diary. Every day for 2 weeks, write down how many hours you slept, how long it took to feel alert, if at all, and what tasks you couldn't complete. Then bring that log to your doctor. This isn't about proving anything to others, it's about finally being seen, with evidence. This kind of fatigue doesn't just drain your energy, it steals your life in slow motion. It forces you to ration every ounce of strength. You don't choose between fun or rest. You choose between showering or making dinner. That's the reality. That's what so many people with Sjogren's syndrome are living with, silently. And yet, this is only the second symptom. What comes next may shock you even more. Symptom 3, joint and muscle pain. You might think joint pain is just part of getting older. But Sjogren's syndrome turns it into something else entirely. Unpredictable, disabling, and invisible. One day, it's your knees. The next, your wrists. Then your hips feel like they're made of glass. And just when one pain fades, another flares up. It moves through your body like a ghost, leaving no visible trace, but a trail of pain. Most people think of arthritis as visible swelling and stiffness. But with Sjogren's, there's often no swelling. Just deep, relentless pain. You try to explain it to your doctor, but the tests come back normal. You're told it might be in your head, or worse, that it's just stress. But this pain is very real. It hits hardest in the small joints, your hands, wrists, feet. Holding a cup of tea, buttoning a shirt, typing on a keyboard. These ordinary tasks become small wars your body fights daily. And it doesn't stop at the joints. The muscles join in. Aching deep in your shoulders, hips, and thighs. Moving feels like dragging bricks under your skin. On bad days, even lifting your arms to wash your hair is too much. What makes it worse? It strikes without warning. You can feel fine in the morning, then spend the afternoon barely able to walk. Plans get cancelled. Commitments fall through. And people stop understanding. The pain doesn't just break your body, it starts to break your trust in it. Here's something you should know: normal blood work doesn't mean nothing's wrong. Sjogren's often hides behind clean tests. If your doctor dismisses your pain, use this exact line: "I'm having unexplained joint and muscle pain that fluctuates, with no injury. I want to rule out Sjogren's syndrome or another autoimmune cause." That one sentence could change the course of your diagnosis. This isn't soreness. This isn't overdoing it. It's your immune system attacking your joints and muscles from the inside out. And no one sees it but you. But now you see it. You recognize the pattern. And that recognition could be the first step to finally getting help. That was symptom number 3, and it's only getting more intense from here. What we reveal next might make you question symptoms you've been ignoring for years. Symptom 4, neurological symptoms. What if your own nervous system was turning against you? What if your hands started to tingle for no reason, or your face felt numb, or you couldn't remember the name of your closest friend? This is the reality of Sjogren's syndrome when it attacks the nerves. These neurological symptoms often show up before the dryness, years before most people are even diagnosed. And that's what makes it so dangerous. You feel the buzzing in your feet. A sharp, electric jolt in your fingers. Your hands go numb in the middle of a conversation. And no one can find the cause. It's called peripheral neuropathy, and up to 25% of Sjogren's patients develop it. The damage starts in the smallest nerves, often causing pain that medications can't touch. Some describe it as burning. Others say it feels like walking on broken glass. But that's not all. There's something more insidious: the brain fog. Your thoughts slow down. Your memory slips. You struggle to recall names, words, even why you walked into a room. Work becomes harder. Conversations start to feel like puzzles you can't solve. Some patients experience symptoms so severe, they are mistaken for multiple sclerosis. In rare cases, the central nervous system gets involved, leading to optic neuritis, spinal cord inflammation, or even tremors and imbalance. This is where misdiagnosis becomes dangerous. Many people are told they have anxiety, or depression, or stress. But here's what separates Sjogren's related neurological symptoms from common burnout: timing and clustering. When nerve issues come with dry mouth, fatigue, or joint pain, even months apart, it's not random. It's systemic. Mentioning that full picture to your doctor is what flips the diagnosis from maybe stress to let's investigate autoimmune. It doesn't just make you feel sick. It makes you feel like a stranger in your own mind. You start second-guessing everything. And when you bring it up, people say you're just tired, anxious, or overthinking it. But you know better. Something deeper is happening. And it's not in your head, it's in your nerves. One more thing, neurological damage in Sjogrens can be slowed or even stabilized, but only if it's caught early. This isn't a symptom you wait on. If this feels familiar, write it down, date it, and bring the timeline to a neurologist or rheumatologist. That one page could buy you years of better function. Neurological symptoms are one of the most frightening signs of Sjogrens. They are sneaky. They show up early. And they don't always go away. But if you're watching this, now you know what to look for, and that knowledge could be what stops it from getting worse. That was symptom number 4. And it's a game changer. What comes next is just as overlooked, but just as serious. Symptom 5, lung involvement. It started with a dry cough. Harmless, right? Just a little throat irritation. Maybe allergies. Maybe a cold. But weeks passed. Then months. And that cough, it didn't go away. This is how Sjogren's syndrome begins its silent attack on the lungs. For nearly 1 in 5 Sjogren's patients, the immune system doesn't stop at the tear glands or the joints, it moves to the lungs. What begins as a nighttime cough can evolve into shortness of breath, chest tightness, and in the worst cases, permanent lung damage. What makes it more dangerous is that it's often misdiagnosed as asthma, bronchitis, or even just aging. But Sjogren's lung involvement doesn't respond to inhalers. It needs immune-suppressing treatment. And without it, the lungs begin to scar. It's called interstitial lung disease, where the tissue inside your lungs becomes stiff, inflamed, and eventually scarred. And here's the terrifying part. Once that scarring begins, there's no going back. You can slow it, but you can't undo it. Even simple tasks like walking to the mailbox can become breathless missions. Some patients end up needing oxygen, just to get through the day. Here's how it usually plays out. Someone starts coughing. It's dry, persistent, always worse at night. They try lozenges. Then allergy meds. Then they're given an inhaler for mild asthma. Nothing changes. Weeks turn into months. The cough stays, and now they're out of breath climbing stairs. But no one connects it to an autoimmune disease. Why? Because most people, and even doctors, don't know that Sjogren's can attack the lungs before anything else. Here's how to spot the difference. A stubborn cough that lingers beyond 6 to 8 weeks without improvement. No mucus. No wheezing. No improvement from inhalers. Accompanied by dry eyes, dry mouth, or unexplained fatigue. That's not seasonal allergies. That's a red flag. Imagine living in fear of stairs. Of cold air. Of climbing into bed, knowing the cough will come back. This isn't just about breathing, it's about independence. Freedom. And for some, survival. Lung involvement in Sjogren's is easy to miss, but devastating if ignored. That dry cough you've had for months? It's not something to brush off. It might be your first and only warning. That was symptom number 5. We are halfway through, but the next sign hits where it hurts most, the gut. And it might explain symptoms you never thought were connected. Symptom 6. Gastrointestinal problems. They say food is life. But what if every bite felt like a risk? What if eating wasn't nourishing, it was terrifying? For many people with Sjogren's syndrome, that's reality. Because this condition doesn't just dry your mouth, it disrupts your entire digestive system. Let's start at the top. Swallowing becomes a struggle. Bread. Meat. Crackers. Without saliva, it feels like trying to swallow sand. You cough, you choke, and suddenly you're afraid to eat around others. Then it hits the esophagus. The muscles don't work right. Food gets stuck, comes back up, or takes forever to go down. It feels like something is always lodged in your chest. You think it's acid reflux, but acid blockers don't help. Then comes the stomach. Some patients develop gastroparesis, delayed emptying. You eat a few bites and feel full. Or bloated. Or nauseous. The food sits like a rock in your gut. And you start avoiding meals altogether. But it doesn't stop there. Sjogren's can even damage your pancreas, leading to something called exocrine pancreatic insufficiency. That means your body can't break down fat, so you get fatty stools, weight loss, and nutritional deficiencies. And yes, it's autoimmune related. In about 10% of cases, the liver gets involved too. Some patients develop autoimmune hepatitis or primary biliary cholangitis. Silent, invisible, and dangerous. You'd never guess it was connected to the same disease causing your dry eyes. This is what Sjogrens does. It breaks you down in a sequence. First, it dries your saliva, which makes it harder to break down food. Then, the esophagus weakens, and food lingers too long. Then, the stomach stops emptying right. Then, your pancreas doesn't release the enzymes needed to absorb nutrients. And before you realize it, you're fatigued, undernourished, losing weight, and still being told to just take an antacid. Eating should be simple. It should be social. But for Sjogren's patients, it becomes a source of anxiety and fear. You start skipping dinners. You decline invitations. You smile while everyone else eats, then go home and quietly battle cramps, nausea, or worse. And if you tell someone, they say, maybe it's something you ate. No. It's something attacking you, from the inside. Gastrointestinal symptoms are the silent hijackers of quality of life in Sjogrens. They rob you of nourishment, joy, and confidence. But now that you know what to look for, you can stop blaming yourself and start connecting the dots. And the next symptom? It hits even closer to the heart, literally. And most people never see it coming. Symptom 7. Cardiovascular complications. She was 42. No history of heart problems. Then, one night, a sharp pain hit her chest. She thought it was a heart attack. But the ER tests were normal. The doctor said it was stress. It wasn't. It was autoimmune pericarditis, and it was the first warning sign. Sjogren's syndrome doesn't just dry your eyes. It can target your heart, blood vessels, and circulation system, silently, and with deadly precision. One of the lesser-known but most serious complications is pericarditis, inflammation of the heart's outer lining. It causes sharp chest pain that worsens when lying down or breathing deeply. Most doctors miss the autoimmune link. Then there are the electrical issues, conduction abnormalities that disrupt your heart's rhythm. You feel palpitations, dizziness, even fainting spells. In some cases, patients end up needing a pacemaker, all because their immune system attacked their heart. But perhaps the most dangerous threat? Blood clots. Sjogren's increases clotting risk, especially in patients with antiphospholipid antibodies. That means a greater chance of deep vein thrombosis, pulmonary embolism, or even stroke. And over time, the constant inflammation accelerates atherosclerosis, the hardening of arteries. That means higher risk of heart attacks, even with normal cholesterol. Imagine that, your heart under siege, and you don't even know it. Here's what makes this so deceptive. Most people associate heart attacks with blocked arteries or bad cholesterol. But with Sjogren's, the threat is inflammation, not plaque. You could be fit, active, have perfect blood pressure, and still suffer heart complications because your immune system is inflaming your heart tissue from the inside out. It doesn't show up on a basic ECG. It doesn't show up on routine blood work. But it's real. And it's deadly if ignored. This isn't about discomfort anymore. This is about survival. You could be eating clean, exercising, and still be a ticking time bomb, because the threat isn't outside your body, it's inside your immune system. And the worst part? It's often dismissed. Especially in women. You're told it's stress, anxiety, hormones. Meanwhile, your body's fighting a war you never signed up for. If you've been told everything looks normal but your chest still tightens, your heart still races, your breath still vanishes on the stairs, don't settle for silence. Ask for autoimmune-specific screening. Echo. CRP. ANA. Clotting factors. Because if you wait for damage to appear on a scan, it might already be too late. Cardiovascular complications from Sjogren's don't always come with a warning. That chest pain? That racing heart? That shortness of breath? Don't ignore them. The stakes are too high. That was symptom number 7. And if you thought this was rare, wait until you see how your kidneys can be silently damaged before you even feel a thing. Symptom 8. Kidney and bladder dysfunction. You feel fine. No pain. No warning. But behind the scenes, your kidneys are being attacked. Slowly. Quietly. And by the time symptoms show up, the damage may already be done. This is what Sjogren's syndrome can do to your renal system. One of the most overlooked complications is interstitial nephritis, a silent inflammation of the kidney's filtering structures. It doesn't cause obvious pain at first. No blood. No fever. But it shows up in blood work, as elevated creatinine, abnormal pH, or electrolyte loss. This inflammation can lead to something called renal tubular acidosis, RTA. When your kidneys lose the ability to balance your body's acid-base levels, symptoms sneak in: extreme fatigue, muscle cramps, bone pain, and frequent urination. Another consequence? Hypokalemia, low potassium. It's more than just leg cramps. It can cause irregular heartbeats, palpitations, and even dangerous arrhythmias. And it often goes undiagnosed because no one thinks to link it to Sjogren's. And it doesn't stop with the kidneys. Sjogren's can also cause interstitial cystitis, an inflammation of the bladder wall. It mimics chronic UTIs, causes pelvic pain, burning, urgency, and disrupts sleep and intimacy. You keep getting told your urine is normal. But the pain stays. Here's what's tricky: your kidneys don't scream. They whisper. They send small signals: low potassium, slight acid imbalance, subtle dehydration, and if your doctor isn't trained to read between the lines, the warning signs are missed. That's why people end up shocked when they're told their kidneys are failing, because the disease was progressing in silence all along. This isn't about inconvenience. This is about organ damage. Your kidneys control hydration, blood pressure, and your body's chemical balance. When they are compromised, the entire system starts to slip. If your blood work ever shows unusual pH levels, low potassium, or unexplained fatigue, ask directly: could this be renal involvement from an autoimmune condition like Sjogren's? That one question can change the diagnosis and save your kidneys. But here's the problem: most people don't even know their kidneys are in danger until they're sitting across from a doctor hearing words like chronic kidney disease or even dialysis. Kidney and bladder complications from Sjogren's aren't rare. They're just rarely talked about. And by the time they are, it's already serious. That was symptom number 8. And if that wasn't heavy enough, the next symptom carries the highest risk of turning deadly. Let's talk about lymphoma. Symptom 9, lymphoma risk. We've talked about fatigue, pain, lung problems, even kidney damage, but this next symptom is different. It's the one nobody wants to think about. But you need to. Sjogren's syndrome can lead to cancer. And for some patients, it does. Studies show that people with Sjogren's face a 14 to 44 times higher risk of developing non-Hodgkin lymphoma, especially a type called MALT lymphoma. It doesn't happen overnight. It's a result of years of immune system dysfunction, chronic inflammation, overstimulated B cells, and tissue damage. The warning signs? Often subtle. Swollen salivary glands that don't go down. Unexplained fevers. Night sweats. Rapid weight loss. Fatigue that doesn't budge. Sometimes, it's a lump in the neck or armpit that just won't go away. And here's the kicker: many of these signs overlap with normal Sjogren's symptoms, which means even doctors miss it until it's progressed. Your body, already battling itself, may cross a line. And once it does, it's no longer about managing symptoms. It's about fighting for your life. So here's what to do: if you've had swollen glands for more than a few weeks, or persistent fatigue that doesn't respond to treatment, if you've lost weight without trying, if your nightclothes are drenched in sweat more than twice a week, you need to document it, date it, and bring it up with your rheumatologist or GP. Say this clearly: I have Sjogren's. These symptoms might be overlapping with lymphoma. I want full blood work and imaging to rule it out. Don't whisper your concerns. Say them with certainty. Imagine managing dry eyes, fatigue, and joint pain for years, then one day, hearing your doctor say the word lymphoma. That fear? That possibility? It's real. And it's why early detection and long-term monitoring are non-negotiable. Blood tests. Imaging. Lymph node checks. Every year. For life. This isn't about panic, it's about power. The power of knowing the risk. Of catching it early. Of staying one step ahead. Lymphoma is the darkest shadow Sjogren's can cast. But now you've seen it. And knowledge is the only light. That was symptom number 9. But the final one, mental health, is the one that touches everything. And most people suffer with it in silence. Symptom 10, mental health collapse. By now, You've seen how Sjogren's syndrome can attack almost every part of the body. But the last symptom? It doesn't show up in blood work. You can't measure it on a scan. But it breaks people more than any other. It's the collapse of mental health. The emotional toll. The silent war inside. You live with fatigue, pain, unpredictable flares. You cancel plans. You miss work. You wake up feeling broken. But people don't see it, so they assume you're fine. That's where the darkness begins. Anxiety creeps in. You're always on edge, waiting for the next crash. Depression follows. You lose interest. You feel disconnected, from your family, your friends, even yourself. And then comes the identity crisis. Who are you when your body doesn't listen? When your memory slips? When joy becomes rare, and effort becomes pain? Science backs it up. Chronic inflammation in autoimmune disease alters brain chemistry. Low serotonin. Neuroinflammation. This isn't in your head. It's in your immune system. And yet, so many suffer in silence. They smile in public. They cry in private. They become ghosts in their own lives. If this sounds familiar, here's what you can do right now. First, know that this mental burden is real. It's not weakness. Second, open up to someone who can truly listen. A friend, a counselor, or a support group specifically for autoimmune diseases. Sharing your reality breaks the isolation. And you may have seen it before. But if you haven't, or even if you have, watch it again. Why? Because that video covers 8 core warning signs that overlap, but also reinforce what you just learned. And by watching both, you're not just learning, you're building a survival map. Click it now. Don't wait. These symptoms don't get better by being ignored. They get worse. And in some cases, they become irreversible. This is your chance to take control. Watch the 8 warning signs. Compare them. Combine them. And most importantly, don't stop learning until you have answers. Click it now. I'll see you there.